Welcome everyone to the session 6 of the ITH Conference 2024. The topic for this session is to discuss the power of evidence to promote trade and health policy coherence. This session, we will follow up on the recommendations from the previous meeting in 2023, such as the regional trilateral cooperation. Also, we will discuss highlighting the importance of using scientific evidence to address the health and trade linkages and identify capacity needed. We will discuss research capacity strengthening and establishing regional platform for evidence generation. Using evidence to identify capacity needed. And lastly, we will discuss the International Trade and Health Conference as a platform for knowledge sharing, networking, capacity building, and policy recommendations to support trade and health policy coherence. To provide us with more details, may I please introduce the panelists and the moderators of the sessions. Please welcome the moderator of this session, Mr. Weerasak Puttasi, Chair WEE Health Development Foundation. Please welcome. As we are starting, may I please invite the speakers on stage? Firstly, may I please invite Her Excellency Phimsanok Phitphil, Ambassador Permanent Representative of Thailand to the WTO and WIPO, WIPO. Please welcome. Secondly, may I please invite Mr. Nima Askari, Director, Asia Pacific Observatory on Health System and Policies. Please welcome. And also may I please invite and also may I please invite Ms. Erica Duenas Loiza, Access to Medicine and Health Products Division. Oh, okay, I'll wait. So in the meantime, may I please invite Mr. Matthias Hebel, Global Lead Scientific Ecosystem Research for Health Department on stage. Please welcome.
Shall we start? Yes. Good morning. Welcome to the session 6 on the power of evidence to promote of trade and health policy coherence. It's our session for 1 hour. Referring to the referring to the recommendation of the last year conference, if you remember. One of that saying about the capacity strengthening, it say about the generating and using evidence for the policy decisions and negotiation position of for maximum benefit of both trade and health sector, as well as the impact of the globalization, deglobalization, digitalization, and regional collaborations in both short term and long term. That's why our session is that try to share and learn how, not only what, but we want to know how from your experience, how the scientific evidence in support the coherence of trade and health policy. It's honor we have 3 panelists on the stage. We introduce the panelist first. This lady is the access to medicines and health product division, WHO, Erika Dones. Next, we have the Matthias Hebel from the WHO Globally Scientific Ecosystem and Research for Health Development from the WHO. The third gentleman is Nima Akasi, Director of the Asia Pacific Observatory on Health and System and Policy, or the APO. The last is Her Excellency Ambassador Pim Chanok Pitfield, the permanent representative of Thailand to the World Trade Organization and World Intellectual Property Organizations. We have 60 minutes to go. We have 2 rounds for the panelists. May I start with you? Erika, we start with. Okay, of course. And the question for the panelists is, what the scientific evidence and capacities in both is significant to address health and trade policy coherence? You may mention the context of the international that you work for, regional or country level maybe, according to the challenge situation that mentioned earlier. If possible, give us for the good example from your experience and what the event you use and how the event can use, or the tactic or something we can learn from your experience to ensure that the policy is effective policy to achieve our outcome of the health and trade sector. Erika, you have the floor.
I can use this. Yes,
Okay.
I can use this one. Good morning to everyone. Thank you very much for inviting me to this important panel and important event. I'm very happy to be here with you to share some of this experience of how the collecting of evidence and assessment of information helped to this important topic of taking a broad approach when we're dealing with all this trade, health, and I will talk also about intellectual property policies that sometimes are included in trade, but they have also some specificities. So for that, I would like to share first this picture where you can see these intersections between public health, trade and intellectual property. This picture comes from the trilateral study we published some time ago, the second version of this trilateral study with our colleagues from World Trade Organization and World Intellectual Property Organization to collect all these cases and objective information about these interfaces. So I like this picture because you can see how a coordinated approach is really needed to taking into account health, IP, and trade variables. So you will see that in order to achieve innovation and access to health products, it is very important to take into account all these variables. You can see how complex it is, but how important intellectual property is also in this picture. So, and in relation to trade, and I think you have already discussed a lot yesterday, but there is also the competition policy and laws that is another very important component that I wanted to highlight here. And you will see in this next slide also that in order to get access to medical technologies, key policies to improve innovation and access to health technologies are also very diverse. You have the trade dimension, you have a human rights dimension that is important, public health perspective, but intellectual property management is also very, very important to take into consideration here. This also comes from this big trilateral study that we published with WIPO and WTO. But what we are doing, and you said that you want me to talk about an example of what we're doing in WHO in relation to that. Since 2008, we have this very important WHO global strategy on public health, innovation, and intellectual property. And this is the main mandate we have in WHO to deal with these issues. I was listening very carefully to the previous panel, and there was a question on free trade agreements and the importance of doing impact assessment. Well, this is one of the recommendations that was included long time ago in this global strategy and plan of action on public health, innovation, and intellectual property, to include the health sector in the trade negotiations and to do these assessments, for example. So WHA, the World Health Assembly, had repeatedly in many decisions and resolutions urged member states, urged the WHO Secretariat and other international organizations and stakeholders to strengthen efforts to implement the recommendations included in the GSPOA. So that is how we call the GSPA, we call this global strategy. And it represents more than 100 recommendations for prioritized actions that need to be taken to promote new thinking on needs-driven innovation and access. This is a very important tool that was already agreed by all member states in WHO, it is also linked with the negotiations that are happening today in WHO in relation to the pandemic treaty, because many of these aspects were already included in this global strategy. We already include, and it's also connected with the work program, global program of work 14 in WHO. Then we have, this is some of the background, because this is very important. As I said, it started in 2008 with a plan of action for many years and several recommendations that are addressed not only to the WHO, but that are addressed to the member states of WHO, that are addressed to other international organizations. So a broad range of stakeholders were included. Then the program was reviewed in 2017 in order to reduce the number or focus on 30 priorities instead of the more than 100, to be more, to try to implement in a better way. And then more recently, this plan of action was extended until 2030 to be coterminous with the Sustainable Development Goals. So there are many recommendations. You will see, this is the main document, but you will see what are the main 8 elements, the 8 elements of this global strategy. And you will see that all these elements are still valid today. You have prioritizing research. I guess my colleague here on my right will talk about that, how to promote research and development, building and improving innovative capacity, technology transfer is a key issue, and of course, application and management of intellectual property, which is the point I'm going to focus more in the next slides. So what does the strategy said in general about intellectual property is that there is a crucial need to strengthen innovation capacity. So this is not new. This doesn't come from COVID. This comes from 2008. And as well as the capacity to manage and apply intellectual property manner, in particular for developing countries, in a manner that maximizes public health, because there are different manners to implement the intellectual property laws and policies. And the strategy says very clearly that it needs to be implemented in a manner that helps public health. And also, one of the highlights is how to use to the full the flexibilities for public health included in the TRIPS agreement. So if you go to the next one, what are we doing in terms of monitoring and the way forward? What are the next steps in relation to the global strategy and plan of action? Well, WHO undertook a number of consultations with member states, with our regional office. I think my colleague Manisha is also here, and she actively participates in that. And the technical teams, in different technical teams in WHO, Matthias also participated in these meetings to provide inputs. And we publish different documents that I don't have time to explain here, but you can find all this information online. I will give you this presentation and the links are there. And you have there the global strategy, the last years of implementation, the results of the member states consultation, and we presented to the last World Health Assembly as well the new implementation plan for 2024-2026. So, and finally, this is my last slide. We also work in good collaboration with our colleagues from WIPO and WTO. The three director generals that you can see in the pictures from the three organizations agreed in November 2023, I think, that members should fully implement at the domestic level the wide range of available options to secure timely and equitable access to health technologies. So that is very important, and we are doing all our efforts with the colleagues organizing different events like the one we're going to have this week here in Thailand in order to facilitate this kind of integrative approach between public health, innovation, and intellectual property. So thank you very much.
Okay, thank you, Erika, for sharing us. You mentioned about the World Health Assembly platform, right? For the global strategy in public health, innovative, and IP. May I have one question for you? In your perspective of that platform, what do you think what the most challenge of using evidence or capacity to move this agenda, move forward of this to adopt the global strategy?
Yeah.
Yeah.
This is a very important question because we had a lot of evidence, even before 2008, with many group of experts published the evidence about the impact of these different areas for public health. But the big challenge is the implementation, because we gather a lot of evidence, we already published this, we have this strategy, but then the issue is the implementation. And unfortunately, this is the big problem, because we saw during the pandemic crisis that all the same topics, that these main elements of the strategy are in discussion, still are in discussion during the negotiations in WHO about the pandemic treaty. But the problem is, how are we going to use this evidence and implement in a proper manner?
Thank you, Erika. Matthias, as a law of the evidence, intellectual property laws and policy, I would like to hear from you about the evidence. What the kind of evidence that you think is important for the policy of the trade and health coherence? Please.
Thank you very much. Just to say that I joined this panel last minute, and this morning in the first session I prepared a couple of slides because Ambassador Pitfield asked me last night during dinner whether I can share some insights. So, but it's my great pleasure to be here. I'm working in the science division of WHO, and the science division was created 5 years ago to make WHO a more science-based organization, to make sure that science is always heard. And today I will talk a bit about what I think is needed still in terms of having better evidence for better trade and health policies. My background is that I'm a trade economist, but also a health economist, and I worked for both WTO and also now working for WHO. And we all know that, of course, trade is a very powerful tool, but I think we also need to manage trade in a way that it really delivers for health. First slide. Sorry. So in 2020, I published a book together with Mark Bacchetta from the WTO, and we looked at trade adjustment in Asia, meaning that Asia was very successful in using international trade to promote economic growth in the region. But of course, trade also requires a lot of adjustments that need to be made. And in this book, we look at the firm level, we look at the labor markets that need to make sure that workers can move across sectors, that blue-collar workers get additional training. So it's not that trade automatically delivers in terms of employment, higher wages. It needs to be also managed. And today I just want to introduce you to two recent studies done by economists and published in leading papers in economics. One is about the impact of increased trade between Mexico and the US on obesity levels in Mexico. And so this paper is entitled Weight Gains from Trade in Foods, Evidence from Mexico. It's a study that was published in 2020, and it uses very extensive data from Mexico. So what they do is they look into the imports of Mexico of US food, and they match this with anthropometric and food expenditure data in Mexico. And so they also have detailed data what goes into each province of Mexico. And on the right-hand side, you see that there was an increasing food trade between Mexico and the US. And these authors, they tried to see what kind of food is imported into Mexico. And they classified into healthy and unhealthy food. And as you can see, Mexico over the years increasingly imported US food and increasingly imported unhealthy US food, so a lot of processed food. And given this detailed data, they were basically able to see whether provinces or regions in Mexico that imported more US food also had a higher rate of obesity. And they found that about 20% of the rise in obesity among women can be actually explained by increased US food imports. This is a study that used a lot of very detailed data, and I think it's very convincing to see that, yes, trade, of course, helps to improve the food supply. It has advantages. You can also, of course, improve the variety of food that you import. But you also need to be careful that you don't see also that people consume more unhealthy foods. Let me give you another example. My thesis supervisor from Yale University published this paper also in 2020, and they were interested in the effect of the increased competition that the US, that some US counties has had with China. In October 2020, the US Congress passed a bill granting permanent and normal trade relations to China. It was called the PNTR. And of course, it was a big step in terms of trade opening between the US and China, and it affected the US regions differently according to their industrial structure. So some regions experienced much more competition than before, others not so much because they were not directly competing with China. And this study used detailed data on the county level. So in the US they have thousands of counties, and they looked at the health outcomes of increased competition with China. So what they found is that they saw a relative increase in what they call deaths of despair, and especially among working age whites. So this increased competition with China led, of course, to job losses. And of course, this led to a lot of mental health problems, led to more drug abuse. Of course, one reason was that it was a sudden shock to the labor market. You had to move a lot of people across to other sectors, which was very difficult to achieve. And compared to cyclical fluctuation in the labor market, this was more a permanent move. So again, the question is, how can a country avoid those health outcomes that, of course, are putting a lot of people at risk? And let me conclude by saying, you know, we all are interested to make sure that trade works in terms of economic growth, but also in terms of achieving better health. And we know that trade opening will require a certain adjustment to labor markets, adjustment to other policies. And I think to really make sure that trade delivers, we need much better evidence. We need more studies on the impact of trade on labor markets, the impact of trade on the price of foods, the impact of trade on obesity, and I can continue. So my plea would be, let's try to encourage researchers to better understand the implications of trade opening, and then based on that we can, of course, design better policies. Thank you very much.
Thank you, Matthews. Thank you for sharing us the evidence from food, health, mortality from different settings. May I ask you some question? From the evidence, what do you think is a good or best strategy to make the power, to make the evidence is more power enough to influence in the decision making from the evidence? I know the evidence is evidence.
I think first of all we have to have more data. For example, also when it comes to the question of is medical travel, medical tourism good or bad for public health in Thailand, we need data on, you know, what's the impact of that on you know, the delivery of health services in Thailand. Or if you look at drug prices, what has been the impact of trade opening on drug prices? So collecting this primary data would already be very helpful. Thank you.
Thank you. And you challenge and concurrent with your recommendation about the intersectoral working is really important, because we have to work with the trade and health and all its determinants. They are quite comprehensive. Next, I'll go to Nima. The Asia Pacific Observatory on Health System and Policy, APO, is the collaborative partnership that you said promotes of the evidence to inform policy as well. Nima, would you like to share us about the evidence?
Thank you and good morning, everybody. It's a pleasure to be here. I was involved in ITH program, I think back in 2012, at the very beginning when it started to establish, when I was working here. So it's very nice to come back and see how much progress has been made. For those of you who don't know, APO is a partnership of member states and WHO regions in both CRO and WIPRO, as well as the Pacific community. And our aim is to increase the capacity to generate evidence on health systems issues and then translate that evidence into the policy realm and increase the culture of evidence-informed policy making, which means influencing both sides, generations as well as the users. And the users is by far the more difficult aspect of that. I've been asked to come here and talk a little bit about if you like, the Asia-Pacific region and the use of evidence. My expertise is not trade by any means, but I wanted to do a little bit of horizon scanning. A lot of conversations yesterday and today has been around IP issues, trading goods, to some extent trading services. A lot of it has been colored with the COVID experience across the region and globally. But if I wanted to, and this came up with some of the conversations I had with some of the organizers, is what, if you want to look at something new, what are we going to be looking at? And it's come up in here. And for me, the thing that is going to be a game changer in 20 years' time is digitalization in health, in the health sector. And by that, I don't mean just telemedicine. I don't mean just having data. I'm talking about a much vaster realm. We're talking about issues around Internet of Things. We're talking about having the hardware to allow automated supply chain management, moving from G5 to G6 technology to allow a much more cohesive transfer of information. We're talking about use of AI in clinical decision making. We're talking about the related regulatory issues. And I think that's one of the areas that I think where there is a lot of scope for future generation on work. This is, at some level, a lot of our conversation at the moment is around health issues, but the reality, and I see that in Thailand, which is much more advanced compared to other countries in the region, is that the negotiation between the health ministries and the other ministries is about pushing the health agenda into other ministries and actually equipping the ministries to do that. So it's about generation of evidence to influence those ministries, and how can we do that? What is the part of the advocacy aspects of that? I see a lot of potential on a regional level to increase overall understandings and capacities of ministries of health in developing that area. And then you can go to nuances. A lot of conversation during the trade agreements was, which cost-benefit model do we use to highlight the impact of the trade agreements on health, for example? How do we actually expand the technicality of it? That's a different way of actually generating that evidence. That's a different way of increasing the capacity, which is much more, the technical conversation which takes place. I want to, and then there's, of course, there's linkages. I mean, a lot of yesterday's conversation around Mode 1 on trading services is about, data transfer. Is about people who don't have the license to provide care in one country providing it through telemedicine, which we see this happening. And the regulatory framework needed at the national level and regional level to bring some of those other aspects into a more regulated place. And I'm saying all of this because I have an ulterior motive. And that is because at the moment, the APO is trying to build that evidence generation modality in Asia Pacific. We actually have a call out to identify consortiums who come together across Asia Pacific to work on 5 thematic areas with APO and the policymakers. And one of those areas is digitalization in health. And I certainly see that. I see potentially equity issues when it comes to trade, again, as areas where there could be a collaborative work done by institutions across Asia Pacific to work on creating some of those public goods which becomes available, which can be used for advocacy, which we can then use to push the generation of the evidence into the evidence-informed policy-making process. That's basically my thinking around this area. I want to pick up one specific topic in this case, which was digitalization, and just go through that process to see where are we going to be looking at in Asia Pacific, vis-a-vis the advocacy issues which needs to be done, vis-a-vis understanding the challenges and issues. And I would also say that, because of my hat, I sit in very different technical areas. And quite often what I see is that the technical groups within the health sector, and I don't mean like, NCD group versus the immunization group, I'm actually also mean like within the health systems group, who don't often understand the context of the issuance between each other and what can be impacted on that thinking. I'm going to stop here, and I'm happy to ask other questions. Thank you.
Thank you, Nima, for sharing us the evidence from the regional platform of the APO. And you mentioned about sometimes we need the technical dialogue, right? Technical evidence that you see, called effectiveness, something like that. And the opportunity for us to work in this forum of the APO. Thank you for us. Next, Her Excellency Ambassador, yesterday's session I heard about you mentioned, and we mentioned about the current landscape of trade issue and health and other challenges, as well as the synergies of trade and health as well yesterday. May I ask you to share us about the inside of the policy decisions, how our evidence to make it more power, what the effective, to make it more effective to the decision making as well as the implementation as well. Excellency.
Okay, thank you very much. And well, sorry to be up here again, but I always speak loud so people won't sleep after the coffee break. Actually, I was asked to participate in this topic a few days before I left Geneva. So, I've been struggling a little bit of what to speak on this. But so I want to draw from my experiences in two areas in health, which is services, because I'm a former services negotiator, and of course health was one of the most important issues. That's where I met Dr. Suvit and then Dr. Sampan and Dr. Chaem. So actually in my mind, services to me is primarily services. But health is primarily services. But in the past few years, I have been ambassador to WIPO and doing intellectual property as well. And last year I was a chairperson of the TRIPS Council at the WTO. And that is why, that is where I'm going to draw my material to speak to you today. So, but before I continue with that, I think this topic was put as the last topic because Dr. Chaem would like to have some ideas from us on what to do in the next, in the future for the conference. So that is what I'm going to offer here, which is some ideas on what to do and the linkage between what our moderators talk about trade and health. When I look at the topic of our conference, which is has always been trade and health, so naturally there must be two components that we have to consider, which is trade and health, but how to link them together. I think that yesterday I offered 6 things that we can do in the future to address the trade and health linkage. I don't want to say nexus or whatever, but I always believe that trade and health can go together without any well, there might be some conflicts or some detrimental effects, but more or less both of them are important for any economy. There is nothing, trade is not more important than health, but health is also can be supportive of trade. So how do we do that? In this particular area where trade data can be explored on how to support this trade and health role in any country, I would like to offer 3 main areas where I think, since listening yesterday and today, three areas where we can step up our efforts on data. First one is to harness the opportunity. And like I said, when we look at trade and health, we have to have data on trade. And what are the data on trade that we could build up? First, of course, is about the barriers. This is particularly important post-COVID, where we have learned from many studies that there were lots of measures related to classification, for example, of health-related goods, classification of the therapeutic and diagnostic, for example. These has been going on with the WCO in Brussels. Of course, there have been trade barriers in terms of border management, like we heard this morning about the example from Mr. Benjamin, that digitalization should have come faster. Otherwise, things get stuck at the port of Singapore because we are waiting for paper documents. So border management related to trade and health, supply chain is very important in my view. Of course, there have been measures that are related to health, such as licensing, regulation, and other product approval. Last but not least, in these examples of trade measures that are related to health is the export restrictions. These I'm talking about this data as trade measures or trade barriers because there have been people and organizations who have compiled these, but they are not yet amalgamated or put together. So I think this is the first area of the data that I think that the organizer may consider doing it for. Maybe not only for Thailand, but for ASEAN or for the region as well. Second area in trade data related to health is, of course, the opportunities. I'm always looking on the bright side of opportunities, and this is especially true for services, which is the area that I think many developing countries in the region have great potential to grow upon. But of course, opportunities in health trade is not only in services. I remember when I started working on health, we did a diagram of the goods in health. What's the word in English? Healthcare products. And these can be from medical devices to pharmaceuticals to อะไรนะพวกครีมแต่งหน้านะคะ cosmetic สมุนไพร Thai herb. All these things, they are potentials. They are health supplements, vitamins. These are there's a big opportunities for health-related products. And also medical devices in manufacturing. And also, of course, services, which can be a lot of things. We have a hospital, we have laboratory, we have a massage, we have a lot, physiotherapist, which I need a lot right now. Maybe this afternoon I have to go find our traditional physiotherapist, meaning Thai massage. So there are a lot of potential, and once again we saw yesterday WTO also have data on services. I think this is another area where we can compile the data and make it more powerful. The next one is I think the data or information to step up our negotiations. I heard a lot of interest on negotiation, on trade, and on health, on intellectual property. That in last year, when I was chairing the TRIPS Council, we organized a conference. We invited 5 groups of people. We had the companies who does collect the data on patients and vaccines dissemination. We have participants from the private sector, the international organization, civil society, and last but not least, the lawyers. And we at least for me, I have the information here. They were very interesting. And so apart from data of, I think there was a gentleman who talked about predictive AI in, trying to respond to pandemic faster. So there are lots of people who are doing work on related to prevention of pandemic or treatment of diseases. I think this is one area, another area where the organizer can explore further. But among those speakers, I heard several of them who were the lawyers. They talked about that flexibility database. A lady, Helen, I think she has that TRIPS flexibility database where she could show that there are, flexibilities have been more widely used than generally assumed, and the database that their organization compiled currently documents 172 instances, of which 122 concern CLs, which we have been asked from yesterday. So CL have proven to be useful in the pandemic. And in addition to CL, which I think maybe we can study further, of course there are the VL, which is the voluntary licensing. Of course there are people who are doing study on this as well. So I think that is my fourth area where we can explore how to use data to step up our efforts. And in this instance, it's about to step up our efforts in negotiations and in policy measures to address the question of CL, VL, as well as the flexibilities. And last tool, which I don't have to elaborate much because I think it will be quite obvious, is to step up the data on research capability, the capacity building to help our researchers, our lab, and how to level up and scale up our domestic manufacturing capacity in terms of pharmaceuticals and other, vaccines or some other important things like even therapeutic and diagnostics. I saw data from the USITC about therapeutics and diagnostics, and actually it's very interesting that in the diagnostic, which like you put something in your nose, right? That is the easiest thing you can imagine. Diagnostic for the COVID. I thought that it was easily produced, but data from some companies show that to make a very effective diagnostic is not easy. You require quite a high technology. It's not a cotton bud that you put in your nose. It has to have some technology to do that. So I think this is but the technology doesn't have to be very advanced like the treatment. So it is one area where we can step up and look at how we can scale up our laboratory and capability in the future. And of course, we can talk about the human resources development in the health care sector, which covers not only goods production, but also services providers, and also the intellectual property area. If I have time, I will expand on some issues, but these are basically my suggestion that we can look further, because these are important, but and in some areas there are scattered information and data around. What we can do is we compile them and make them more useful for Thailand and ASEAN, and maybe for the regional, in the countries in the region. So these are my suggestions for now. Thank you.
Thank Excellency. I learned from you that you mentioned about data first, data and link them together. I'm thinking of the win-win strategies for both sectors in support each other of trade and health working together. And you mentioned about the information. We have to know the information of the regulations, opportunity, yes, medical device and wellness economies. Yeah, everything about this one, and capacity of the negotiations and research capacity in various areas. I'm thinking of our conference, International Trade and Health Conference. We have been organized since 2014 as the platform of the knowledge sharing, networking, and capacity building. I would like to ask all panelists before we return to the Q&A from the floor. What will you recommend us, as I mean the platform, our platform of the conference, to strengthen the power of the evidence and also the capacity as well to promote of the trade and health working together at the policy coherence of trade and health? You may specify the recommendation to the academia sectors that you mentioned, or the health sector or trade sector, as well as for the organizing committee as well for the next idea of the conference, maybe. Would you like to start first?
Yeah.
Just a short.
Yes, thank you very much. In very interesting presentations here as well. I just want to comment quickly on what the ambassador said about this TRIPS flexibilities database and how this evidence should be used. As I said before, there is a lot of evidence, for example, in relation to the use of, you mentioned also, Ambassador, voluntary licenses, which are very important for technology transfer purposes, but we have a lot of evidence, public evidence as well, that this how these voluntary licenses were used, for example, during the pandemic, or how these voluntary licenses exclude systematically many middle-income countries like Thailand that have the capacity to manufacture. So there is a lot of evidence in relation to that. There is a lot of evidence that the TRIPS flexibilities, for example, should be used to promote public health. There are databases. WIPO Secretariat recently published, and it was discussed during the last standing committee on patents at WIPO, a document that contains a lot of information on what are the reasons why the countries are not using these TRIPS flexibilities for public health. So this is also very important and valuable information that it is available. But the problem again is how the countries are going to use all this evidence in a good way. We had a lot of information about the impact of free trade agreements, in particular the intellectual property chapters of free trade agreements. I see Dr. Germán Velázquez there, but many Latin American countries prepare some assessments of before these negotiations, but then at the end we realized that they didn't use the evidence, the existing evidence. So that is how the policy components are also very important to be connected with the evidence. And of course, evidence can come from different sides, right? Can come from different origins. So we need to be careful also to taking into account the conflicts of interests for the who is producing this evidence and this information.
I want to respond to
Thank
that.
you.
Okay.
Okay.
Excellent.
So I'm my point is that I'm not supporting CL or VL or whatever. My personal approach for things is always that we need to study and understand better what are available, for us. I use any tools if it will help Thailand go through the pandemic, for example. What I was just suggesting is that there are many people who are work on different issues out there, and that we should study from them. Thailand did have voluntary licenses to produce vaccine, COVID vaccine. But like I said yesterday, and I understand the point that you are mentioning, because when I was the chair, I had to consult so many many countries. I consult with them like at least once a month. I heard all things from all sorts, and in the seminar that we organize, we also have evidence from India, from South Africa. You know, surprisingly, companies in India were quite positive, but in South Africa there were a lot of problem explained to me. So I sympathize and I understand everything, and that's why at the end of my sharing, my impression and strong impression is always that all things come back to building domestic capacity. If you don't have the capacity in your country, no matter how many regulations or flexibility you get from negotiations, you cannot use them. I'm speaking this, you know, I'm very convinced on this. The situation, there was one situation which Colombia explained to me, ambassador. He is a doctor. He was a doctor during COVID time in his country before he became ambassador. So he was personally involved with COVID treatment. And the problem with voluntary licensing in the case of Colombia was what they call themselves, I think not they call themselves, but it's like a sandwich country. There's a need for COVID vaccine in that country, but because they don't have sufficient capacity in domestic to produce them, the country could not, or maybe choose not to produce in Colombia, but have to go to Brazil. And because of the terms, then it is difficult to be, for vaccine or something produced in Brazil to be exported to Colombia. So these are the difficult situation of several countries who are big, but not big enough to make vaccine or some other medicine, or to, you know, not able to persuade the companies to set up the facilities in that country. But on the other hand, there was a situation in African country where a company chose to establish a vaccine production there, but the government did not support the company. So the company that they produced had to be ต้องทิ้งไปค่ะ it could not be used, it expired, right? Vaccine has shelf life. You cannot produce vaccine, and if nobody buys their own vaccine, it has to be thrown away. So there are all sorts of things surrounding this. I'm just giving some examples of, yes, that's why we need to talk about data, but there are things out there that we can explore further. Yeah.
Matthias, where you at?
Yes, talking about vaccines, and you mentioned the World Customs Organization. Next week I will travel to Brussels because over the last 6 months we have been working on a new classification in the harmonized systems of vaccines. So there is one HS code for vaccines, human vaccines, and whenever there is a pandemic, having only one code doesn't really help to accelerate customs procedures of let's say COVID-19 vaccines. So over the last 6 months we tried to establish a new HS classification for the international trade of vaccines, and we hope that this will be accepted now during the session at the World Customs Organization next week, and then it will take 2-3 years until this new classification will take effect. So by 2027 I think we will have a much better and refined classification of vaccines, which would allow then to collect better data on international vaccines trade. By talking about vaccines and local manufacturing, I think in the coming years we will see more and more efforts by governments to produce locally. And of course this is a big investment because, as you mentioned, Ambassador Pitfield, it requires high tech, it requires a lot of efforts. And this will need a big financial commitment by governments, and resources are scarce. So it's also it might have an impact also on public health expenditures. So I think this could also be an interesting topic to see how we manage this expansion of local manufacturing. What does it mean for health? How can it be made kind of coherent? And this brings me also to the topic of regional coordination, because of course not every country can have its vaccine manufacturing or even diagnostics. We have to think about how to split the task and how can we, as a region, as ASEAN, for example, find a way to coordinate those efforts. I think that's not easy. Yeah, over to you.
Thank you. I'm going to come back and try and answer your original question about what should the conference do. And I think of when I was doing my thesis, the conversation with the supervisor was, we need to have a journal of failed experiences, because you only publish the ones which actually give results, but you get a lot more if you understand what doesn't work. So then the question, and I'm being tongue-in-cheek in here, is whether or not there should be a topic about things that don't work, challenges which what we tried and it didn't work, is just as useful as a mode of conversation and mode of sharing experience. And ITH is fundamentally about sharing experience, the ITH conference. It will be a very rich discussion. It will be a very vibrant discussion.
Before we closing the session, I understand that we have time to allow the invite the floor. If you have any question or reflection or observation to add, please. Yes, please.
Thank you. I'm Nusala Porn from Khon Kaen University, Faculty of Pharmaceutical Science, and a part of the FTA World Network. Yeah, I would like to thank for the global strategy and plan of action, public health innovation and intellectual properties that framework the 8 elements. And I like to share the implementation that our network have done from this element to strengthen the pharmaceutical industry in Thailand and promote the access to medicine. There are 3 parts that I like to share. The first one, from the strategies, we did a lot of impact assessment from the free trade agreements. The first one is the Thai-US FTA. And after that, Thai-EU FTA. After that, Trans-Pacific Partnership Agreement and CPTPP. And currently is the second Thai-EU FTA. Yeah, knowledge from the research was shared to our civil societies. For example, Ganika and Jockey is a part of the civil society to advocate the policy maker during the negotiation process, including the knowledge also sharing to the Thai FDA, which is a part of the negotiation team in the aspect of the medicine and access to medicine. Yeah, this is the first one. The second one, we try to prevent the evergreening patent, which is very important to promote the generic drug industry in Thailand. And I like to thanks to the WHO ICT-SD guidelines for examination of pharmaceutical patent. In Thailand, we use this as a reference and modify to fit in the Thai context. And right now, the Department of Intellectual Property, Ministry of Commerce, already have this guideline in Thailand, and now we will monitor the implementation of the guideline. The last one, we do the research to propose the strategies to strengthening or improve the capacity of local pharmaceutical industry in Thailand. And this is also very important because in Thailand we depend on the import dependency of the pharmaceutical product is very high in Thailand. So that's why we propose the proposal to strengthening our local industry. This the example of the research that we done and share with our stakeholders. And we also would like to thanks to the big data that we can access from the Thai FDA and also from the Department of the Intellectual Property, because this data we have to model the impact and also modeling the scenarios to propose the policy makers. Thank you.
Thank you. Next.
Chulamsak from the FDA Watch and also from the Thai network of people living with HIV and AIDS that work really hardly on to promote access to affordable medicine. I would like to thank Ajahn Nusalapon as well that mentioned about the impact assessment on the FDA. We are a civil society that make use of this study quite a lot to advocate with the policymaker and also with the patient network as well to understand what the implication of the principal provisions in the FDA negotiation. And also we have used her study on the evergreening patent as well to advocate with the Department of Intellectual Property to develop guideline on the patent examination, particularly on medicine. So this is the outcome or the evidence or the study that we have used. And for this discussion, I have few comments to make as well. As I heard Elika and Ambassador mention about CR and VL. As I work on the promote access to medicines quite a lot, we have seen the evidence that the VL is a barrier actually, not the way to promote access actually. I would like to raise an example about the hepatitis C medicine that costs about 10,000, $1,000 per pill. And we try to advocate the WHO to include the medicine in the helping package. But 5 years, no any movement or any progress at all until the Malaysian government issued a CL on this medicine. So that company that filed the patent on this medicine, they use a strategy to stop the CL because they're afraid that the other country is going to issue the CL as well. They issued voluntary licensing to include Malaysia, Thailand, and the other two countries to make use of this license. So from that, the price of medicine reduced from $1,000 to less than $10. That's why the patient in Thailand can access to that medicine because of the CL issued by Malaysia, not the VL. Because we have to say that CL is like incremental, tools to put the pressure on the patent holder to issue the VL. By the VL itself, it has the property itself, as Elika mentioned. It has some problem in terms they exclude the upper middle income country out of that. That's a problem about the VL. And secondly, I would like to come to the point about how to promote the local capacity, particularly on the pharmaceutical industry. I recognize that it has two barriers at least. The first one is our patent law itself, about the patentability that not allow the local industry to do R&D and develop the new medicine, or even the new generic medicine. That's one barrier. And the second one is about government procurement chapter in the EU FDA that proposed to Thailand. Right now, Thailand, we have quite a good government procurement law that try to support the local manufacturer to do R&D and to produce medicine at cheaper prices. And also we have another law that to promote R&D and innovation as well. But according to the government procurement chapter in the EU FDA, it will not allow the Thai government to maintain or enforce that policy. So that's my concern why we cannot accept this kind of the provision and chapters that can undermine access to medicine in Thailand. Thank you.
Please.
I am Herman Velázquez from the South Center. I have a question to Erica, that if you find the question very difficult, take it only as a comment, because I know that this is difficult to respond. Your very good presentation on the global strategy, I think there are many resolutions of the WHO in the last 15 years talking about the intellectual property, health, and access to medicines. And the 6121 is probably the best. It's very, very clear. It's very strong resolution. It's not a casualty that was extended to the 2030. My question is now, with the present draft of the treaty, that they call treaty, but I was saying yesterday that there is a friendly agreement, what is going to happen if the wording and the mandate given by this treaty will be weaker than the global strategy? That apparently is something that is going to happen. Thank you.
Okay. Okay, it's for you. And the last chance for the panelists, if you have the short reflection or key take-home message for the audience. Erika first.
Yes, thank you very much, and thank you for the three questions. They're all very important. I just wanted to highlight the importance of the role of industry, local industry, and civil society organizations, because as you mentioned, there is a lot of work that needs to be done also by the generic industry and also civil society organizations at the local level. We know how they act at the international level, but at the national level, it is very important. All you things you mentioned about the GSPOA recommendations in relation to trade, or the evergreening of patent, and all the recommendations that are provided by WHO in relation to that, in the guidelines, in the different documents. We are very happy, just to let you know, that the WHO is very happy to continue providing all this support to member states upon request of them, of course, in relation to facilitating the use of TRIPS flexibilities for public health, or it was mentioned as well the hepatitis C case, which is very important. WHO also talking about evidence. We publish and we update the access to hepatitis C report every year, every 2 years, and we include all this information about lack of access in some countries, about possible solutions. You mentioned the compulsory licenses, of course, were used, but the patent oppositions played also a very important role in other countries. And that was, in many cases, initiated by civil society organizations in different countries, Brazil, Argentina, I think Morocco, but several countries. And that played a role, a very important role to access to hepatitis C drugs. About your question, Herman, I think it is very difficult to answer because we still don't know the content of what is going to be the final document. But I think, and this is more for the treatment of the pandemics in particular, the good thing of the global strategy is that it covers, it is broader, right? It covers not only pandemics, because access is needed not only for the pandemics, but access and innovation also for other diseases. But of course, it is a very important negotiation that we need to follow up and to see that this doesn't undermine the current efforts. So, but that is a member-driven process, of course, so I cannot say too much about that. Thank you very much.
materials?
Sorry,
Oh, sorry.
just one more comment about what the colleague said about digital health, which I fully agree with you. This is a very important topic that I wanted to touch here because there is a lot of artificial intelligence that is already being used for health purposes. I participated just last Friday before coming here at the WIPO event on artificial intelligence and public health. And as you know, it is already being used a lot for health purposes, for diagnostics, for clinical trials, for health services. So WHO has many publications in relation of how to treat ethics and confidentiality and all of this in relation to that. But I also wanted to mention that intellectual property will be, again, an issue in relation to that information, because who is, that countries need to take into account already, because who is going to own, there is already a fight and discussions about who is going to own these data sets that are produced by artificial intelligence for health. So we will need to think about flexibilities and safeguards again since the beginning in order to avoid the misuse.
Okay.
Thank you.
We have to conclude the session on time. Key message for you?
Just one quick point. It was interesting to hear that local manufacturing seems to be a key topic for Thailand, and I think with that local manufacturing it also needs, of course, a good R&D and a health research system attached to that. And I think for now we always focus on the trade in goods, related to health or services, health services. But I think we should look a bit broader to see how trade affects, for example, the movement of researchers, or how trade can bring into the inputs into research. So really focusing on these other types of trade that enable a good health research system. Thank you.
Okay. Dima, taking home message?
Thank you. I still think that there is, I acknowledge everything that you've said. I agree with everything that you guys have said. The challenge that I see is how do we use the available evidence in influencing policy which is outside of the health sector, which health sector is dependent on for its functionality. And I think that's a critical issue that needs a lot more capacity building in the country, and it's specific to the country as to how and what.
Excellency.
Thank you. I think earlier this year I was present at the WIPO Innovation Award, Global Innovation Award, where this year Thailand has, for the first time ever, we had a winner, and it was an entrepreneur, a startup called Meticuli, who made bones replacement from 3D printer, and which has shortened the time of bone replacement from months to a couple of weeks, and very customized. This is the trend of the future. So what I'm saying is that trade and health is a very important area, and technology, like Erica said, and not only digital, but in terms of new technology and intellectual property, of course, will be playing an important role. But I still view trade health sector as something with great potential for Thailand and for the region. So my final point would be thank you for the organizers, and good luck. This may be my last year here, so wish you all the best, and whatever I can do to help, please count on me. And thank you so much for the commitment from Dr. Suvit, Dr. Sampan, Dr. J.M. for all these years. Thank you.
Yes, as moderator of the session, I myself learned a lot with challenges of the evidence and capacity that you mentioned to accommodate both health sector and trade sector with benefit both together. Hope you, the audience, enjoy learning and sharing and discuss as well. With my appreciate. Please, the floor approach to the other panelists, please.